Dr. Jann Murray-García is a pediatrician and a founding faculty member and associate health clinical sciences professor in the Betty Irene Moore School of Nursing. Dr. Jann founded and directs the Summer Institute on Race and Health, a 4-year non-clinical experience for TEACH students and others who have completed their first year of medical school, and the Interprofessional Central Valley Road Trip. In January of this year, she was named as Director of Social Justice and Immersive Learning in the Office of Health Equity and Diversity and Inclusion. We are so excited to have you here, Dr. Jann.
All right. Can I share my screen, Carly?
Yes, of course. We would love that.
Okay. All right. I'm going to go in and out between screens, so please forgive me if it's not a full screen. If you can't see for some reason, let me know, but we should be good. Can everybody see my screen?
Yes.
All right. So we're going to talk about repeating history, U.S. policing and lessons for health equity efforts. I have no disclosures or conflicts of interest to report, and I just want to thank everyone who put together the CHEq conference. I don't know what year it is. It's been amazing. Your leadership has been absolutely fabulous, starting with the cohort that included Dr. Ian Kim, who's with us today.
And Annie Tat, who's also here.
Oh, and Annie Tat. Annie! Okay, so we're going to talk about repeating history, U.S. policing, and lessons for health equity efforts. Just summary points. We continue to live history. It's possible to be pro-police and pro-police reform, especially considering the positions folks put the police in. Number two, we're going to be asking, hopefully, what was the problem or script the police were supposed to solve? One of them will be protecting white women from Black men. Again, what was the problem the police were supposed to solve? Another one is Black folks' self-determination upsetting the social order, especially the economic order. And what was the problem the police were supposed to solve? Black folks' invasion of residential white spaces. All right, most important part of a script. Those of you who know me know I love this analogy of a script that we're performing together. You know you're performing a script when the outcome remains the same generation after generation, and that's inequality in this discussion. All right, I just want to say it's possible to be pro-police and pro-police reform. It's possible to be patriotic and pro-police reform. We could go on forever. It's one of my favorite people. One of my heroes, Natalie Corona, was 22 years old when she was killed in Davis, answering a call for a car accident, actually. She's actually the same age as my daughter. She used to go into the cafe where my daughter used to work and order her cherry lime Italian soda. So I can't be part of demonizing the police a priori. They're some of my heroes. I don't know why anyone would do this job. I cannot wrap my mind around the fact that at every shift, you may never see your loved one again. So I just want to make that clear. Those are her parents up in the upper right-hand corner. And she was a star athlete, and that's her little sister there. And I know the picture in the upper left, let me just say that I know for some people that picture brings terror with the police lights. This is the caravan that led Natalie to her final resting place in Arbuckle, where she grew up. And for some of us, though, that picture brings terror and you can almost hear the sound of the sirens. Just remember, for a lot of folks, including her family, that is such a profound sense of loss. Okay, first point, it's possible to be pro-police and pro-police reform, especially considering the position we put folks in. I'm going to talk about one of those positions, which encompasses the question about what problem were the police supposed to be solving in US history, and how are we still performing that script. protecting white women from Black men. This is not 1963 or 1831. This is 2020. Amy Cooper in Central Park, who had her dog where she was not supposed to have it, and a Black man who shares her surname but not her blood, asked her to take her dog out of the park. And this is why I needed to be able to be nimble. I just want to show that that little piece film clip, okay? And I am going to, please bear with me. I find this fascinating. Dr. Jann has learned a lot, but not nearly enough. Okay, so this is Amy Cooper, You and Me, 2020.
Please don't come close to me.
Sir, I'm asking you to stop recording me.
Please don't come close to me.
Please take your phone off.
Please don't come close to
And
me.
I'm taking a picture calling the cops.
Please call the cops. Please call the cops.
I'm going to tell them there's an African-American man threatening my life.
I want you to be clear about how carefully Amy, whether it's subconscious or not, understands that if she sets in motion a specific historical script, she will be believed without regard for what danger that puts the Black man in.
I'm sorry, I'm in a ramble, and there is a man, African-American, he has a bicycle helmet. He is recording me and threatening me and my dog. There is an African-American man, I am in second grade. He is recording me and threatening myself and my dog.
Okay, I'm going to stop there. It was interesting, the last part of that, which they didn't show, was her getting really upset because the folks on the other end wanted clarification, and she's like, please help me, please help. All right, so what's that script? Do you all see my PowerPoint there? Yeah? Okay, great. So what's that script of the white woman who needs to be saved from the Black man? And that is as old as the history of our country. It is why race was created, actually. Racism needed race to be legitimate. This is a film from 1915 called The Birth of a Nation. It was technologically amazing. Everyone saw it. It was reviewed at the White House, and it is about, it spurred the rebirth of the Ku Klux Klan in the South. In this scene, there's a young white woman who's being pursued by this Black man, quote unquote, white man in blackface. And that's the issue. She's running from him, terrified, and there's a white man chasing after her, coming to save her. Okay, that is a horrible film. It is 3 hours long, but in so many ways it has informed the heritage of our, of many of our white Black brothers and sisters, our white brothers and sisters, sorry, who think of this as their heritage. And it's a problem for us, right? And it is an example of, again, the position we have put the police in. You can demonize the police all you want. You can say that they are a problem that stands outside of us and our history, but I don't believe that. This is from last week, actually, an African-American student who just graduated from high school, went to Stephen F. Austin as a freshman there, woke up to armed a SWAT team banging down her dorm door because her friends did this thing called swatting, where you call the police on a Black person and say that someone, and say there's a violent crime going on. So you don't just get the police, like I've had the police called on me for being in a park with a bunch of other Black folks in Davis. You get a very deadly situation potentially. And we're living that, right, with Breonna Taylor, et cetera. There is a psychiatrist, anthropologist, Jonathan Metzl, who wrote one of the most important books of the decade, in my opinion, called Dying of Whiteness: How the Politics of Racial Resentment is Killing America's Heartland. And he talks about how this kind of embracing of this narrow, dysfunctional, untrue so-called white heritage has led to a level of violence, vigilantism, this idea that as in toxic white masculinity, I need a gun and that's patriotic because I've got people to protect from them. Y'all feel me? From them. And it is an old script, as old as this country. Hopefully that's helping you see how history is so important. Second, what was the problem the police were supposed to be solving in terms of Black folks' self-determination upsetting the social order? That was the problem. The solution was to criminalize normal behaviors, meeting those behaviors with control and not humanity. So in Sacramento and Del Paso Heights, if you were jaywalking in the last couple of years, you were 3 times as likely to be ticketed by the police than in other neighborhoods. In Los Angeles, from 2014 through 2017 through 2019, Black folks received 30% of the non-traffic infraction tickets, even though they make up only 7% of the population. Again, we just need to make sure Black folks know they're still subordinate. Hello? It's woven into our everyday life together. Where does that come from? I know we start American history with 1776 or somewhere about there. Actually, for race relations, we had a couple of centuries before, starting with Latin America, of course, and the first Europeans to enter United States were not the Pilgrims, they were Cortez y Columbus through Latin America. In northeastern, the colonies in 1676, there was something called Bacon's Rebellion. And it was when Virginia white folks wanted help from the Virginia landowning elites on the coast to fight Native American folk and to take their land. Those white folks were rebuffed. Bacon was somebody who was against Governor Berkeley and his Virginia government. And he put together an army that included whites, indentured servant whites, lots of them Irish, free Blacks, and Blacks indentured servants. Many of us don't know that before 1619, Blacks were working as indentured servants. It was an unsuccessful rebellion, but it terrified white folks. And William Zinn, in his book, People's History of the United States, said it was a potential combination of poor whites and Blacks that caused the most fear among wealthy planters. What made Bacon's Rebellion especially fearsome for the rulers of Virginia was that Black slaves and white servants joined forces. And there were white folks and Black folks having families, and this terrified the power structure, which in this national story happens to be white folks. Following Bacon's rebellion, wealthy whites made greater distinctions among poor, enslaved, or indentured folks by doing the following: by race. Amnesty was given to white folks for their rebellion. South Carolina, where my ancestors are from, required plantations to have one white worker for every 6 black slaves so that you could not foment rebellion. Blacks were forbidden to carry arms. Hello, everybody know the history of gun control in California is when the Black Panthers started carrying guns, open carry, like other white folks had done through their neighborhoods. That's why we have gun control in California. Not because white folks were doing it, but because black folks were doing it and upsetting the social order. After indentured servanthood, whites got muskets, guns, cash, and corn. Black folks were put in slavery, and then this slave patrols were created, and they were manned by poor white men. So it became a job, hello? It became a job to police black bodies, and we're still there. I'm gonna go on because I don't have a lot of time, just to know that. How does that kind of maintenance of the social order, what can we learn from that in medicine? How can we learn from that? Well, history informs what we do in medicine, whether you realize it or not, whether you are aware of these scripts that we're still performing. In 1968, there was a landmark article in the Archives of General Psychiatry. Again, Jonathan Metzl, got to read his stuff, wrote this book, The Protest Psychosis, where this is the first health disparity I know that has a date, a starting date, y'all. And it was because white psychiatrists were seeing black folks embrace the self-determination of black is beautiful, black power. That became pathologized as delusional anti-whiteness and aggressive feelings, especially after listening to the words of Malcolm X, joining the Black Muslims, aligning with groups that preach militant resistance to white society. And this is Jonathan Metzl's words. According to the authors, these black men required psychiatric treatment because their symptoms threatened not only their own sanity, but the social order of white America. Bromberg and Simon argued that black men who espoused African or Islamic ideologies adopted Islamic names. So somebody like Muhammad Ali, that was psychiatric pathology. Somebody like Raheem Reed, one of our associate vice chancellors, Raheem, that would be evidence of pathology. Again, paranoid projections of Negroes. So here's what I want to say about this and you, is that this was, the protest psychosis was a new form of schizophrenia that was put in DSM-2. And if you look at what is going on here, it's not that there's anything wrong with the black folks. They're coming into their own sense of identity and pride in a racialized society where they've been culturally and otherwise subordinate. What is the problem is that it made these clinicians uncomfortable. Hello? It wasn't pathology of black people, it was people's discomfort that then pathologized normal black behavior. Y'all feel me? Thomas Jefferson wrote of blacks and their ability to tolerate pain. He said their griefs are transient, those numberless afflictions are less felt and sooner forgotten with them. Again, it's okay to work black people literally to death. Oh, and also it helps our social order, right, of wealth making. Why am I even saying that? Well, now today we know that black folks receive less pain medication, Latinos, Asian patients, poor patients do not have the same adequacy of pain control as white patients. In this particular study, which was done also by Nate Cooperman, who runs our ER, they looked at appendicitis from 2010 to 2013. There were 800,000 of them, all of them pathology confirmed. When they looked back to what happened in the ER, they found that Black children 0 to 21 years of age were less likely to get any pain medication, even after controlling for age, gender, insurance status, you feel me? And then also controlling for pain score. So if you had an 8 and you were an African American, this wasn't, oh, you know, people manifest their pain differently, different culture. No, if I told you my pain was an 8 as an African American child, at every age you were statistically significantly less likely to get narcotic medication. And we don't have time for the back and forth, but I'm just going to say, in my years of presenting this, there's several historical scripts, right? There's the script of control of Black bodies. There's the script of Black people feel less pain because we actually needed them to feel less pain to use them like we did. There's, I'm not responsible for your comfort. You can handle it. I can go on to other things. You are a patient I can cut corners on. Do y'all feel me? It's not just the police who are performing scripts of inhumane social control. I'm going to go in and tell my 20-year-old to stop singing. He goes to Berkeley College of Music and he's singing and I can hear him. Hey, Gabi. I hear you, babe. Okay, he apologizes. He's in there making music, literally. All right, third one. What was the problem the police were supposed to be solving? Black folks' invasion of white spaces. And some of you know this well. This is the issue of redlining. The police actually in the South had their history in the creation of slave patrols. And these white men who got these jobs, think about the prison industrial complex and what happens if it disintegrates, right? That's a lot of jobs of high school educated people who are making $100,000 to $200,000 a year. This was how the police force in the South started, right? Imparting economic advantage to the disadvantage of colored folk, including Native American people. In the North, when people fled during the Great Migration, after in the early 20th century, the police were used to keep them from getting on the train. So a lot of Black folks had to actually drive or walk to the next county and get on the train so they would not be recognized. Again, to hold them back to a life that relegated them to lower parts of the employment hierarchy. Think about COVID today, hello? To keep that in order. The police were used to do that. In the North, because there were so many Black folks moving to these industrialized cities, the police were then used, not then, but separately, because the North always felt like it was better than the South and how it treated Black folks. But the police were used to keep people in racialized spaces. Hello? In 1932, a Democratic president created the Federal Housing Administration, which relegated, was supposed to jumpstart the economy of the Depression with construction building and folks could buy houses. The issue was out of the $210 billion that was allocated to underwrite the loans of people who would not get loans otherwise, 98% of those public funds went to white folks to establish the suburbs. Y'all feel me? 98%. That money is the equivalent of $4 trillion today of public funds that flowed out from everybody's community to white folks. Y'all get it? Not white folks' problem today, not white folks' blame today, but it is a reality we have to live with. And if you remember, even just in the last week, in the last 2 weeks, our president talking about, you're gonna lose your suburbs. You're gonna lose your suburb. The poor people are coming to the suburbs. This is the history that he's hearkening back to, encouraging people to perform it again with a vote. Hello? When he's in Wisconsin and he's talking about the gene pool of Wisconsins, and you don't want to mess that up, he is hearkening back to the history of the eugenics movement of that same time, where you want to maintain the purification of the white race by forcing sterilization of people of color, Black, Latin, Native American folks, forcing sterilization of broken white people who are cognitively or otherwise disabled, mentally disabled. When he's telling the Congresswoman who's a Somalian immigrant to the United States, a United States Congresswoman, to go back where she came from, to not mess up our country, and that's what we can learn from history, y'all. This is the redlining map of Sacramento. This is the pocket. This is UC Davis. This is the east-west corridor of redlining. This is Del Paso Heights. This is Oak Park. This is South Sac. This is from 1970. This is the most current census data of the population of Latino and Black folks in Sacramento. You see the east-west corridor. This is the pocket. This is Del Paso Heights. Hello? I'm gonna go on. This is where schools were closed in 2013. The darker spaces are Latino population concentration. So most of the schools, the public policy of today follows the redlining maps of 1932. Hello? This is preventable hospitalizations. Hospitalizations for high blood pressure and asthma are preventable by definition, a kind of quasi-measurement of the adequacy of primary care, okay? This is the pocket. This is the east-west corridor going towards Carmichael. Del Paso Heights, Oak Park, and South Sac have the highest. It looks like the redlining map, yeah? Looks like the redlining map. Diabetes, injury, pocket, east-west corridor, north-south corridor. Hello? Injury, assaults, pocket, east-west corridor. I dedicate this presentation to Jesus Hernandez, who taught me this, urban sociologist. At every age, by neighborhood, you're more likely to die if you're in Del Paso and North Highlands than in Oak Park, South Oak Park, and hello? It's the same historical script, right? I'm gonna keep going to COVID. September 2020. The pocket, the east-west corridor out towards Citrus Heights, Carmichael, North Highlands, South Oak Park. Hello? So important that we understand the history. What problem were we trying to solve when we created these redlining maps, right? Those racialized spaces, which make people more vulnerable to disease, are still being recreated and recreated. That's why it's so important for us to know history. I am going to end. What's the solution? I just want to talk about Measure U and how it was supposed to be like this gathering together of public funds to redistribute into neighborhoods like like South Sac, Meadowview, where Stephon Clark was killed. That's how it was sold. Ironically, this year, half of that money went to fund the police. It's just ironic, right? Again, police not bad, but just ironic. Let's just end because I want, oh, wow. I'm so sorry I didn't leave time for questions. Darn it. So ask me questions.
Thank you so much, Dr. Jann.